Those treatments that we were advocating for threatened all of the pipeline pharmaceutical high profit items that they wanted to make billions off of.
I am severely troubled by the fact that the NIH, the FDA, and the CDC, everything has been about novel and or expensive pharmaceutically engineered drugs. Mountains of data have emerged showing the miraculous effectiveness of Ivermectin.
They don't want you healthy. They want you to depend on their medicines and their drugs, and they want you to get ill because it's a big business.
Today, I am honored to be joined by an incredible guest, Dr. Pierre Kory. Dr. Kory is an internationally renowned physician, pulmonary and critical care specialist, and the president and co-founder of the Frontline COVID-19 Critical Care Alliance, or FLCCC for short. His groundbreaking work during the COVID pandemic, particularly in advocating for the use of repurposed drugs like Ivermectin, has made him a prominent and sometimes controversial voice in global medicine. Dr. Kory's career spans decades of frontline medical practice and academic leadership. He's authored over a dozen peer-reviewed publications on the topics of treatments for COVID-19. But beyond his clinical expertise, he's also a passionate advocate for medical freedom, transparency, and the ethical use of science in public health. In this conversation, we dive into the systemic challenges Dr. Kory has faced, from disinformation campaigns and industry backlash, and the potential of repurposed drugs in modern medicine. So whether you're here to learn, challenge your thinking, or find hope in the evolving world of healthcare, this episode is one that you will not want to miss. Let's welcome Dr. Pierre Kory to the Astin-Gregory podcast.
Dr. Pierre Kory, when I first came across your work, it was as a result of your impassioned plea at the Senate back in December 2020. And for me, that was a poignant moment because I'd already been heavily involved in challenging the COVID policies. I'd been heavily involved in the activist scene in the United Kingdom and increasingly beyond the United Kingdom. But it was at that moment that I realized that we were dealing with something bigger. And I saw just how intensely the system was co-opted, corrupted, and the resistance to using existing drugs to treat people who were suffering. And what struck me most was not only your impassioned plea, but the qualifications that you brought to this, the mounds of evidence, and yet all of that was rejected and continues to be rejected, not just in the field of treating COVID, but beyond that too, which is what I'd like to get into today. But before we get into that, how did that, just taking you back to that moment in 2020, how did that feel when you were bringing mounds of evidence and just coming up against brick walls? How did that feel for you as a physician?
Yeah. Oh, wow. You know, there's been so much that has happened, Dan, and I still remember that podcast and talking to you, and it was really good. I think we went a long time, and that time was such a frenetic. We were literally in a world emergency, right? And I, as a doctor who was becoming expert at COVID or became an expert at COVID, I was, drowning in so much things and attention. But here's how I want to answer that, there, because I think it's kind of like a twofold answer, because as much as I was frustrated with the attacks by authorities and agencies and media, I was at the same time, emboldened and inspired by all the people I was helping, like the individuals that were reaching out to me, patients that I was treating. I was putting them on. Like, I remember in that first wave when I started using Ivermectin, I mean, most patients, once they started, within 12 to 24 hours, were like, wow, Dr. Kory, my fever went away, my chest tightness went away, I'm breathing easier, and that was, for a doctor, that's about especially a lung doctor, and you're dealing with a pulmonary disease, that's about as satisfying an experience you can have. So it was really, in some ways it was really good, and I realized that our messages were getting out. So Dan, you talked about that testimony. One of my cool memories about that testimony is, like, literally within the next few days, I was getting invitations from physician organizations across the world in all these different countries, and like Austria and and they all wanted me to just give them a talk and let them know, what I was doing, what I was finding. So and that's what I did for a living. I was a medical educator. So I literally that part was fun, talking to people around the world who wanted to hear the, information and get guidance. But then, to bring up the other stuff is, The other stuff I had to learn, and that was a slow journey and an uncomfortable one, the stuff that I then had to learn, which is that, I've always said, like, I didn't think I was going to get like a ticker tape parade after that testimony, but at least I thought like people would be generally appreciative and like the authorities would be like, wow, this group has found some evidence that we should probably take a harder look at, because they might have found something to treat this. And when that didn't happen and the opposite happened, my paper gets retracted under the most weird circumstances, which is so common nowadays. I mean, the amount of retractions of like inconvenient papers that have happened, from lab origin to, vaccine adverse effects, the toxicity, the lethality, all of those things, they just get routinely retracted now. But when we got our ivermectin paper retracted, that was kind of like the first, like, whoa, what's going on here? Actually, that wasn't the first. The first was the Associated Press interviewing me like the next day after the testimony and then putting out a hit job that night. That was so ludicrous, so unethical that that was like my first inkling, like, oh, this isn't going to be so easy here. But I didn't know how hard it was going to get. And the rest is in the book, I guess, Dan. But yeah, going back to those times, I was learning really good things and then really unpleasant things at the same time.
Yeah, well, in the course of that Senate hearing, you had to assert your qualifications. It was almost like they were trying to smear you as some political figure, which was just so far removed. And I do want to honor your credentials and qualifications. And I also want to talk about some of the things you've been through this year in terms of losing some of your certifications. But for some of our new audience who are coming to this for the first time, tell us a little about, your qualifications, your certifications, your history, just to give people the context, because you weren't just some random politician.
I had never had anything to do with politics. Now, I was, I went to medical school, and I'll give you my little funny route into what I became. So I went to medical school originally to become a pediatrician. Because I was like, I had this romantic view of like, the artist Norman Rockwell, a famous American artist, but he drew these very kind of romantic, very emotive scenes from last century of like the family doctor leaning over and listening on the chest of a child. And I had this like rather kind of romantic view of being a pediatrician and a family doctor. And then I found out I hated pediatrics, which makes more sense now. But then I wanted to be a psychiatrist, then a neurologist. And it ended up, I went into internal medicine, but I became a pulmonary and critical care specialist. So I became an expert at lung diseases and then intensive care medicine, which is taking care of, life-threatening illnesses. And about 20% of patients in ICUs die. And so it's a tough specialty, but, I really loved what I did and I was quite successful. I mean, I became the chief of critical care at the University of Wisconsin in Madison, Wisconsin, which is one of the biggest research institutions in the country, and had a big, busy ICU. We got patients helicoptered in from all over the region. And I was the chief there. I was the director of the main ICU, and I became well known in my specialty because I was a pioneer in something called critical care ultrasonography, which is basically making life-saving diagnoses at the bedside using ultrasound. And I wrote a textbook that got translated into 7 languages. And so and I traveled the country and even the world teaching doctors. And I found that so satisfying. I love teaching. I became the director of a training program for my specialty in New York City. And that's what I did. I hung out with fellows, residents, students, taught, researched, wrote, and I was having the time of my life. Probably a little bit of a workaholic, but other than that, I really enjoyed it. And then COVID came, and me and my colleagues, I was really close with Paul Marik at that point. We had a shared interest in intravenous vitamin C and sepsis, which was his work. And I later discovered just how impactful it was. It was saving lives like I'd never seen before. I was turning patients around that I'd never seen turn around with the rapidity that they did. And so he and we became very close as critical care specialists around IV vitamin C. And then when COVID came, we were just on the phone every day, sharing papers, learning everything we could. And then we launched our nonprofit, the FLCCC, because nobody was giving any guidance on how to treat this thing. And as Paul says, one of his phrases is the best. He says, there is no disease you cannot treat. And I love that phrase, and it was totally true. Meanwhile, what is everyone around the world doing? Saying, go home until your lips turn blue. And it was so disorienting and somewhat shocking and really absurd and troubling too, to see that nobody was willing to try stuff. And I left my first job in COVID. I left really over a moral, like almost a moral and ethical protest, because I was the clinical leader at that hospital. And my superiors were really coming down on me negatively for suggesting that maybe in some of the really sick patients, we should use blood thinners or we should use corticosteroids. Because at the time, corticosteroids, everybody said, don't use it, it'll make it worse. And I knew that's what they needed. And I said I could not be a leader of practice because all they wanted to do is supportive care only, right? Which is fluids, oxygen, ventilators, Tylenol, and food, and hoping that they would recover. And they weren't recovering. They were so sick. And I knew they needed an aggressive treatment. And I refused to watch people die, thinking there was nothing they could do. And so I went to New York, which is where I was from, during their first wave when they got hit. And I continued to see patients in ICUs until my public advocacy made me unemployable. Because the more I learned, the more I talked, and the more good ideas that I had for people, more people wanted to talk to me, and I became much more of a nuisance to those who didn't want my opinions to be shared. And so you get the whole drill, right?
Yeah. Well, for those who haven't been paying attention, why was that?
So why were my public advocacy so unwelcome?
Yeah.
Yeah, well, it's because almost all of it gave relatively inexpensive, widely available, really safe and highly effective treatments. And those treatments that we were advocating for threatened all of the pipeline pharmaceutical high profit items that they wanted to make billions off of, least of which, or the most of which, would be vaccines, remdesivir, Paxlovid, molnupiravir. So basically, we found our little nonprofit of well-meaning expert doctors, lung doctors, ICU doctors, who became quickly expert at treating a very complex and very aggressive critical illness. We tried to put out guidance. We found that with this little nonprofit called the FLCCC, suddenly we were up against like the entire pharmaceutical industry. And we got, and what I learned and what I documented in my book is the amount of levers that industry can pull, right? Like complete control over major media through advertising, right? There, especially in the US, it's absolutely insane. Like there are no major media that can say anything bad about a pharmaceutical product, because why would you do that when that's where all of your income comes from, right? 75%, I think, of advertising is pharmaceutical at this point. And then to learn about the control of the agencies and, basically, to sum up my book, Dan, the war on Ivermectin, it really was inspired by an article called the Disinformation Playbook, written by this organization called the Union for Concerned Scientists. And that article was written in 2017. And when I read it about 3 months after my testimony, it's like not only a light bulb went off, but like suddenly I saw the world in a really clear and structured way that I couldn't figure out before. And it's because that article, the Disinformation Playbook, they basically list the 5 tactics that industries deploy when science emerges that's inconvenient to their interests. And what was I in the business of at the time, Dan? Emerging inconvenient data to that industry. So if you find yourself that's actually now your new job is to, produce and disseminate, really inconvenient scientific data to very powerful interests, you find that your life gets real interesting. And not to get too dark, but there's other scientists in other fields with other discoveries who actually get unalive. But let's leave off that drama. That didn't happen to me, but I certainly lost jobs with pretty alarming regularity, and I certainly got hit hard in the media. Not that I care. I wasn't a celebrity. I don't give a crap. And I will tell you, my kids knew what I was doing. They trusted me. They look up to me. My wife did. My family did. So all my friends, families, and colleagues, I had their full support. Well, I don't know about colleagues. I will say this, because I had such a wide network of colleagues and former trainees, and many of them used to reach out regularly and call. But in COVID, the phone actually wasn't ringing as much as it used to. And I think they kind of, I don't know what was in my former friends and colleagues, because they knew what kind of doctor I was. I trained half of them. They knew that I was a good doctor. And I think they must have just thought, Pierre, he must have lost his way. And He's obsessed with ivermectin and he doesn't know what he's doing or something like that. Or he likes the fake. I did get a text from a really close friend of mine, which I was very offended by. But about a year and a half in, he tried to reach out and check in kind of. But I found his text to be ridiculously offensive. He was accusing me of enjoying my political and newfound fame and that, he was hoping I was okay. And it was just bizarre. But anyway, I don't want to go into all of that. But yeah, it was a crazy time. And I learned about disinformation, right? And disinformation playbook was invented in the 1950s by the tobacco industry, right? And the pharmaceutical industry has now become most expert practitioners at it. And they are wickedly successful. I mean, they can make you believe, something toxic is good for you, and they can make you believe that something that's life-saving and cheap and safe is really bad for you. And they do that all the time, and they mess with people through really propaganda and censorship.
Well, as it happens, I actually in preparation for today, I actually brought the 5 principles from that playbook that I wouldn't mind walking through with you, actually, just to get some wider context. So the first, the fake, conduct counterfeit science and try and pass it off as legitimate research. What does that mean?
That is their most powerful weapon. And I think that's the foundation of the playbook. Without that play, you can't do the other tactics. But the fake is something I've been doing for decades, which is, let's say, particularly when you're talking about repurposed drugs, things that are off patent, therefore not profitable, or actually you can't say not profitable. They're not obscenely profitable as they enjoy when they're under patent protection with no competition, right? So it's not that you can't make money off of ivermectin, it's that you can't make the ridiculous billions that they make off the other stuff, but they basically know how, and it's not that hard to do, but they conduct these, I'm going to use air quotes here, rigorous, high-quality, large, double-blind, placebo-controlled, randomized controlled trials, and they'll conduct it in such a way to show that the medicine that they're studying doesn't work. And very simple tactics they can do to do that. And then they publish it in the highest impact journal in the world, and then it screams across the nation's or the world's newspapers, basically that. Latest large, high-quality ivermectin trial shows that it is completely ineffective in COVID. And 2 things that you can find out. You actually can read the paper and find out, well, actually, if you look carefully at the data in this paper, it actually shows that it works. That's happened. Or you look at the paper and you realize that the way they designed and conducted the trial, there's no way you could have ever shown that ivermectin was effective. And so the fake is huge. And by the way, they can do it both ways, right? They can manipulate studies to show stuff works, a la Pfizer vaccine trial, which was completely manipulated and fraudulently conducted. And yet they come out saying it's 95% effective and it's super safe, right? And we know the exact opposite was true. And so, but they've been doing this kind of thing for a long time. And but to see it play out in a world emergency and see so many people sick and knowing that there were simple solutions and they're pulling this crap, it really, for anyone who has any modicum of morals or ethics, it was truly disturbing. And you had to go after it. And I did with my colleagues. We tried to call it out.
Before we continue, I want to let you know that in order to sustain this show, we're now partnering with brands that truly represent the values that we stand for. Ultimately, with the goal of helping you to discover products and services that can make a difference to the quality of your life, whilst helping us to grow the impact of our show. Have you noticed the financial world is shifting? Inflation is eating away at savings, banks are becoming harder to trust, and central bank digital currencies, or CBDCs, are looming on the horizon, threatening to erode financial autonomy as we know it. If you've been thinking about crypto as a way to protect your wealth, but feel overwhelmed, worried about scams, or confused by all the technology, then you're not alone. This is exactly why we created the Navigating Digital Assets course, a fully updated, beginner-friendly course designed to help you to securely navigate the world of crypto and digital assets with confidence. This course has already helped over 500 people to gain clarity on how crypto works, how to invest safely, and how to secure your assets in an ever-changing financial landscape. With holistic guidance, jargon-free explanations, and £197 worth of bonuses, this course will give you the tools and confidence to navigate this paradigm shift in finance And as a follower of this show, you can get 40% off the regular price and enroll for just £29. But don't wait, this offer will end soon. Visit danastingregory.com/NDA today and take the first step toward protecting your wealth and securing your financial independence. You'll find the link below this content.
Well, it's interesting, my previous show, the Pandemic Podcast, at the height of it, we were reaching millions of people. It was crazy. We were one of the first sources in the United Kingdom. We went, global with our reach, but because of that reach, we had a lot of inbound communication, and we actually attracted a whistleblower who was involved in one of the Oxford trials, I believe, around Ivermectin. And they sent us a message anonymously to say that they were using dose levels that would clinically show that this is ineffective. They knew that the trial was being manipulated to produce the result that they wanted it to, which was that they wanted to demonstrate that it doesn't work. And that for me was another blow. It's just how corrupt. And to me, I'm not in the industry. I'm not in the industry. I've never been in the industry. I've got friends in the industry now, in the medical industry, the scientific industry. But it's one of those things where, and actually your testimony did this when I watched this, and I shared it widely, because for me, actually, in my mind, I fell to my knees because I was feeling how corrupt this system is and how people are losing their lives as a result of this. And at that point, I think like yourself and many others, we were narrowly focused on this situation relating to COVID. But I think as time has progressed, we've now looked more broadly and the blinkers have come off.
Yeah.
And we've seen just how corrupted the industry is. And in fact, when we spoke 2 years ago, I've taken a quote from our interview, and I'm curious to know if this is still true. You said that the entire practice of medicine is co-opted or was co-opted during the pandemic. Do you still hold that to be true?
Yes. Not only do I feel that's true, but I feel that applies to the practice of medicine for many decades, if not a century. That it's been co-opted and controlled by immense financial influences that have varied over time in power and impact, but money is so directly controlling and influencing how we approach disease and medicine and how we treat patients that, I find it's sad. And, remember, I was a doctor 15 years into my career when COVID came out. I did not know that. I thought, I've said before, I thought the journals were putting out the best science by the best scientists. And it was all in the pursuit of knowledge and power to heal. And we were all trying to do the right thing and just figure out how best to care for and treat people with certain diseases. And you come to find out, no, it's about using therapies that make people the most money. And I'm sorry to say it like that. And it sounds almost trite, but it sounds almost unbelievable, right? Because people had such a high, physicians in society in the practice of medicine was under quite high regard historically. They were some of the most trusted people in our communities and society were physicians, right? And I'm sure you're aware of this, Dan, but like 2 months ago, a paper was published in JAMA, one of the biggest journals in medicine, showing that trust in physicians and hospitals in 2019, the U.S. average citizen U.S., 71% of them trusted their doctors and hospitals. You know what it was in 2024? 40%. So when you think about it, almost the vast majority of people trusting their doctor and their hospital to now a minority of people trusting doctors and hospitals, you see that it's exposed medicine for some of those uncomfortable facts about it that I uncovered, that I've disseminated, and I think a lot of other people saw. It wasn't just me that woke up. It was a good portion of the country. And again, I don't want to get too political because I'm not a politician. I don't want to get into politics, but I think that awakening and that awareness that all was not well and the government did not behave, the government did not protect us from corporations. And by the way, that's actually my political philosophies. I actually think governments are there like the referee on the ball field, to call fouls and make things somewhat fair. Meanwhile, the ref was literally letting these corporations run right over us with the most absurd scientific policies that you could ever imagine. And so, it was quite an awakening for me.
What's interesting in sport, the focus is often on the player throwing the game, and actually, what about the referee in this case? And that's a great analogy because it really does feel like the referee is being bribed to throw the game. That's the reality. The second principle in this 5-point disinformation playbook is the blitz. Harass scientists who speak out with results or views inconvenient for the industry. Have you ever seen that happen?
The blitz, right? So
I wanted to ask that with a straight face, but I couldn't. I've seen too much.
I mean, just look at my life, man. I got blitzed like up the wazoo. I mean, so talk about the blitz, right? So they harass scientists that are bringing forth this inconvenient science. And in the actual original article, the case study that they used to illustrate that tactic, actually going back to sports, they use the National Football League. They use the NFL over the issue of chronic traumatic encephalopathy, right? Which is, the microhemorrhages of the brain that these retired football players fall ill with. And they talk about Dr. Bennett Omalu, right, who is a pathologist who found this out. He started looking at these retired football players, and as he was doing autopsies, he saw just tons of microhemorrhages all over their brains, and he'd never seen that before. And he started to realize it's those repeated hits with the head throughout their careers. And he started to publish on it. And what happened to him? They went after him, boy. And there's a major motion picture about it, right? So it's not just Pharma does that. That's any industry will do it. The NFL did it. And the joke I make about that is the NFL is a $9 billion industry. The pharmaceutical industry is a $1 trillion industry. So if the NFL is willing to go after, one lonely pathologist for threatening a $9 billion industry, they're going to think of what Pharma can do. But, I mean, listen, the first move they did was the AP, right? So they send the Associated Press after, not after me, but to do this ridiculous hit job.
Their claims, Pierre, in that hit job.
Okay, so no, it's what they didn't claim. I spoke with this seemingly interested journalist, and I was just telling about all that I had learned and all of these studies and all these doctors and all these communities around the world, like in Peru and other places, in India, where they were literally, absolutely crushing COVID with ivermectin. And I gave her all the trials. And so is this what I thought was somewhat of a scientific confirmation. And then the article came out, and the headline was, "Ivermectin, not a miracle cure for COVID." And then in the article, ivermectin is barely mentioned. Instead, they just say, it's almost like this is another medicine to debunk, like hydroxychloroquine. And then they actually talked about some couple that drank a fish cleaner or something, thinking there was chloroquine in it. I just did an interview about my expertise. I thought she was interviewing an ivermectin expert in COVID. But the article had nothing to do with me or ivermectin, really, except to say that ivermectin, some guy, Dr. Pierre Kory, claimed in the Senate that it worked, and then they probably used the typical tag is they just get somebody with a bunch of letters behind their name, at some august institution who just says, and it's always the same thing. The evidence is low quality and insufficient. These are small trials from black and brown countries. Well, they don't say that part out loud, but that's how I hear it. But that was basically the formula of that. And I don't know if we talked about this, Dan, but this goes to show you how naive and how much I still had to learn. But me and my colleagues in the FLCCC, we filed a formal ethics complaint to the Associated Press, to their ethics department. And what's really interesting about our interactions with the Associated Press is one day there was a reply all from the CEO of the Associated Press to his colleagues, and he didn't realize that we were on that email.
Wow.
And it didn't reveal too much. What it did reveal is that they were paying attention, because it was the CEO, the president, and then the ethics chief of the Associated Press. And they were basically telling each other, just delay them, buy us some more time. So I don't think they were really worried about us, but you could tell the highest people up in the EP were talking about our ethics complaint. And I think 4 or 5 days later, the head of ethics wrote to us, said that they've reviewed the story. They find that everything was correct and the journalist did nothing wrong. And we were just like, well, that's part of how I had to learn the world that I really lived in. Not one of journalist ethics, that's for sure.
Well, it's one thing being smeared in a publication, a media publication, but I read in an article in August that you've had 3 of your board certifications revoked. It's had a real impact on your actual ability. It's not removed your ability to practice medicine, fortunately, but that's a pretty heavy hit to take.
Yeah. So that was an interesting process, right? So for your audience, a board certification in the US, it's just a specialty designation that you have passed a higher level exam. It used to just be like a badge of distinction. You could walk around, puff out your chest and say, oh, I'm board certified in 3 different special, which is what I kind of used to do. Although I'm not an arrogant guy, but yeah, you would do that when you wanted to invoke your credentials, it'd be like
medical muscles.
Yeah, exactly. But the problem is what happens with the boards is they have since weaponized it. It's a voluntary thing. You don't have to be board, or you didn't have to be. You just paid money. You took this higher level exam. You got your board certification. Then you could walk around with your boards. I think it was good for patients, probably good to attract patients. But over time, they've now made board certification a requirement of not only working for hospitals or academic medical centers, but also a requirement to be on an insurance panel. And what's interesting is that when the boards formally accused myself, my partner, Paul Marek, my colleague, Peter McCullough, and a couple other doctors of being misinformationists, and they sent us a letter with these very public statements and quotes that I had made, every single one of which I stand by today and can defend. They just called it misinformation. They enacted this new policy, and they said, you guys are in violation and defend yourselves. And for the next year and a half, I think our first events was 75 pages, 200 references. I literally defended every single thing I'd ever said. And they wrote back saying that you're wrong, essentially, because like when I would talk about how dangerous the vaccines are, they say you're clearly wrong because the WHO says on their website that they're safe and effective. But literally, that's the level of rebuttal that I was getting, is that I can't be right because the gods of science and knowledge say that I'm wrong. That's literally, and I'm watching this between like a specialty organization. And then we appealed, we defended our appeal. We finally had a hearing in front of doctors. And by the way, these doctors were very sympathetic to me. They were very sympathetic to Paul. We co-defended ourselves with a lawyer. They could ask questions. And I will tell you, I could feel the room. These doctors that were in this panel, they respected what we had done. They knew that what I was saying and what I said and how I defended it was well supported with evidence. But I also knew that they were patsies, Dan. They were not the people making the decision. And it's weird. It went so well that Paul afterwards, and Paul would laugh if he was here, but Paul was like, I really think those doctors, they know. They know we're right. They know we didn't do anything wrong. They know we're not misinformationists. And I said, Paul, if you think that we're going to be found innocent, I said, you're crazy. And sure enough, a month later, we got our boards revoked. But to your point, Dan, I left the system of medicine, so I'm in private practice now. I do telehealth. So I don't have an employer, so I don't need my boards to work for a hospital. I'll never work for a hospital again. I don't take insurance, which I already couldn't take insurance just because the kind of medicine that I practice now, the medicines and therapies that I use, like insurance companies would never support what I'm doing, because I'm not following, the rigid guidelines set forth. And so it doesn't bother me that I lost my boards. In fact, the week I lost my boards, I was seeing patients the following week. It was so cool, Dan. Every one of my patients like, Dr. Kory, I saw what they did to you. It makes me so angry. And they're like, but you have to understand, Dr. Kory, that is a badge of courage. You losing those boards tells me that you're a good doctor. It's like, I was shocked. Like, my patients were so supportive that their physician lost their boards. But they understood. They understood what this was about. It wasn't about me doing wrong. It was about me doing right against some pretty bad people, and that's how they punish you. By the way, Dan, let me give you a little anecdote. I swear to God, I'm not making this up. So I told you that I moved. I was just in the middle of a move today, and I was unpacking my office. I have tons of books and stuff, and I pulled out a folder which has all of my nice diplomas and everything, from my academic career. and I found my 3 very beautiful engraved manila board certification for the American Board of Internal Medicine, Pulmonary Disease, Critical Care Medicine. So I have the 3 of them, and I have a little fire pit outside, which I make a fire every evening. And so me and my wife decided that this evening I would be burning those in honor of what they did to me. So I'm going to do a little bonfire. I think I'll put it on Twitter or something.
We should have included it in this episode. But unfortunately, your Wi-Fi probably won't go that far if you just haven't got set it up yet. Number 3 was the diversion. The diversion, manufacture uncertainty about science where little or none exists. I think we kind of touched on that, but could you elaborate on what that really means?
Yeah, so that I think is hard to unpack from the fake, where they do these manipulated trials, because that is about creating uncertainty. But I would say a good example of diversion is something I kind of mentioned, which is, and this is what just, there's nothing that triggers me more than this, and I keep seeing it, is that anytime you talk about a potentially effective therapy, if it's cheap, safe, not patented, repurposed, they constantly will just dismiss the evidence as being low quality and insufficient. And so, no matter how much evidence you have, it's never enough if it's one of those drugs. If it's a barely tested, highly for instance, remdesivir became standard of care nationwide in this country from one trial that was manipulated, didn't even show it saved lives or anything. And literally we spent in that first year $3 billion on remdesivir, right? On one trial. Here I had 60 trials.
Double standards.
Yes. And I have 60 trials. Admittedly, they're small and everything, but you can combine small studies and you can get a big evidence base. And no matter if you try to do that, they just say it's insufficient, low quality, uncertain. And so they just inject doubt anywhere so that anyone who reads a newspaper article about ivermectin, you're left with the fact that, okay, maybe there's some trials showing it works, but it sounds like there's a lot of trials that show it doesn't work. And the ones that show it works aren't good quality, says this god of science and knowledge, right? Like someone from Oxford, from Harvard, from Yale, it's the same formula over and over again.
What do you make of peer review? Because I've always thought about peer review. I've been thinking about that. I'm like, who's the peers? It depends who you're selecting as the peer to review this, because if it's just the same old faces, then, well, you're going to get the same old conclusion. But am I oversimplifying things? What's your take on peer review?
There's problems with peer review, but I think there's bigger problems than peer review. So peer review, generally you get reviewed by similar experts in the field, and at high levels, the people reviewing each other's papers know each other and know their work. And so they're either probably overly supportive or overly critical. And so there's some personal stuff that messes up peer review. The other problem with peer review is that you're not paid. I used to peer review papers when I was a young academic because I thought it was part of my responsibility and commitment to medicine, and it's what you did. Plus, I was interested to read papers before anyone else could, and I wanted to see how I'd evaluate. But it's an immense amount of time, and to do a really good peer review, you really have to devote the time, and it's unpaid time, and most doctors are overworked. And so I don't think a lot of crappy papers get through probably that shouldn't if you had a more professional organized system. But what I want to tell you though, Dan, the problem, it goes above peer review. It's the medical journal editors. That's the problem, because you can get anything peer reviewed and pass. It's what they decide to publish. And that's why when we talked earlier, when we started talking, I brought up the issue of retractions. I've been writing about the retractions, and they've retracted almost any major paper that found serious problems with the vaccines. And the amount of problems with those vaccines are almost innumerable at this point, and many people have detailed, described, documented, written about, published. But the most troubling papers get retracted and or rejected. And so I write a lot about that a lot in my book. I give a lot of evidence of all these researchers around the world literally writing to me. They're like, we can't publish. We have a good study, well done on ivermectin, shows it works, and we're getting just, the rejections were piling up from journal editors. And it's almost like there's a memo that goes out. And actually, I don't think it needs a memo. The journal editors, they know what they can and can't publish without some pharma rep walking into their office threatening their careers, right? I think they already know that without the memo. My favorite thing is something that Bobby Kennedy said when he was campaigning for president. He was asked a question about, like, about the problems with medicine and the agencies and public health. And they asked him, like, what is one of the first things that you would do if you were to become president? And I loved his answer because it speaks to what I was just talking about. And he said in that interview, and I was like literally in my living room clapping. He goes, my first order of business is I'm going to bring in all of the major medical journal editors into the Oval Office. Now I'm going to threaten them with RICO prosecution unless they clean up their act. And he nailed it because he basically referred to them, not literally, but figuratively, as an editorial mafia. And that's actually a chapter in my book. It's called The Editorial Mafia, because I believe it is literally a collusion of, if they don't have criminal intent, they are committing crimes.
It's time for a quick word from one of our partners. If you believe in the freedom to communicate, the right to privacy, and freedom from corporate surveillance, then you need to check out Proton. Many of you would have heard of Proton Mail. Proton is born out of the desire to create an internet that puts people before profits. Proton helps you to maintain control over your digital life, whether it's sending messages encrypted through Proton Mail or browsing privately with Proton VPN or securely storing your important documents with Proton Drive. Proton is the ultimate tool for safeguarding your digital freedom. Don't let your data be sold or your privacy be compromised. Go to danastingregory.com/Proton and start using Proton to protect your digital life today.
Crazy. I mean, throughout this, I was kind of viewing Fauci as some kind of medical mafia don at the top of the tree. And, and like a true mafia boss, I think they still continue to have influence even when they're not technically in power. And you can see that ripple effect. The last two on the list with the screen: buying credibility through alliances with academia or professional societies. The badge of honor from trusted Harvard and Oxford experts that you said.
So the best example of that one is what I call the horse dewormer PR campaign, right? So did you guys get a PR campaign of horse dewormer in the UK?
Of course.
Okay. But here it was just outrageous. I mean, that's all you could hear. So a friend of mine told me how to recognize PR campaigns is he says they're basically all 2x4s. And I'm like, what's a 2x4? He said 2 weeks, 4 different sources of media, same story over and over. He said that's a PR campaign. And when he told me that, I was like, oh, that's like the horse dewormer campaign, because the way it came out and the way it was conducted, but it was total immersive. It was like 360 degrees. It was when it got going, it was daytime talk hosts, late night comedian hosts, news programs. It was like everywhere. Horse dewormer, right? But what's interesting about go back. What were we talking about? The which tactic is
screen? Yeah, but credibility through alliance.
Right, really. Okay. So the way the horse dewormer campaign was triggered is, and I write about this in my book, and I'll run through it really briefly. But in early to mid-August, a report came out showing ivermectin prescriptions being filled in the U.S., and it showed this meteoric rise. And basically, what that data shows is that U.S. physicians were figuring out that ivermectin worked, and they were prescribing it like crazy. And I think that's when the other side decided to act. They realized that they had to do something because so much ivermectin was being used, people were going to know that it worked based on their lived reality. They wouldn't need the papers and the journals. They would just know that Uncle Tony turned around when Dr. Kory gave him ivermectin, and that would just magnify and amplify. But so they saw that the U.S. was starting to use ivermectin like crazy. So what happens? 3 days later or 4 days later, the FDA tweet comes out, right? Which is the, what is it? You're not a horse, you're not a cow, stop it, y'all. Right? And they had the horse picture. It became the most famous tweet in the FDA's history, and it went viral around the world. And this is where I maintain is that tweet was crafted by a PR agency. I can guarantee, and I believe I know which one it is. I talk about it in my book, the name of which escapes me right now, which is the, I can't remember the PR agency, but they work for Pfizer, the CDC, and Moderna. Okay? And so that tweet went out on August, I believe, 19th. 3 days later, the CDC sends out a memo to every state Department of Health, which then sends it to every licensed physician in that state. So basically in 24 hours, you have a memo from the CDC in the inbox of every licensed physician in this country. And what does it say? Rise in poison control center calls or overdoses around ivermectin. When you actually read it, and 2 investigative journals has actually looked into this memo, it was literally, I think, a rise of 2 calls to 1 poison control center in Missouri, and there was no overdoses. And so it was this completely fabricated concern that ivermectin is a danger. It's one of the safest drugs in history. It's safer than aspirin, Tylenol. We all know that by now. But the CDC sends out that memo 3 days later. So you have FDA, CDC, and then on August 29th, you have a guy named Anthony Fauci go out on national television, and I'm going to do my Anthony Fauci impression. He goes out there, and he's talking to Jake Tapper, and he goes, don't do it. There's no clinical evidence that this works. There's no clinical evidence that this works. And I think he got stuck on his talking points. And at that day, and I've had this in my lecture, but on that day, there were 63 controlled trials of ivermectin, 32 of them randomized. On the day that he went out on national television and said, there's no clinical evidence that it works. Now, you could say more accurately, or maybe more defensively, you could say there's no good or high quality, which wouldn't be true, but that would be his opinion. But what he said was a flat-out lie. Okay, so now you have August 19th, August 26th, August 29th, 3 agencies, a sequence of actions, and then the media takes off with it. And that's when you start hearing horse dewormer. And the funniest part is Joe Rogan got COVID on September 2nd. Right. So if you think about how they're ramping up this horse dewormer campaign, so FDA, CDC, NIH, right, the third agency with Fauci, and then Rogan gets COVID. So what happens to Joe? He becomes the poster boy for ivermectin, right? Remember how, like, they made his face yellow and everybody's attacking him for, oh my God, taking ivermectin. I mean, he took a bunch of stuff. He took, some vitamins and other things, and I think maybe even an antibiotic, but who knows? But and then you just saw weeks and weeks of just saturation in the media and they never used the word ivermectin. It was always horse dewormer, horse dewormer, horse dewormer, and which is a shame because it's a medicine that won the Nobel Prize for its impact on humanity, not the animal kingdom, on humans, by eradicating 2 of the most disfiguring and deadly diseases in the world, right? Onchocerciasis, or river blindness, and then elephantiasis, or lymphatic filariasis. I mean, that transformed the health status of low and middle income countries across the world because of its anti-parasite properties. And so, it's a shame to see ivermectin treated that way, but it also, that's what propaganda is, right? So propaganda, the best definition of it is, propaganda is a story or a message to get you to think or act in a certain way. And that is effectively what disinformation is. And so going back to, allying with professional societies. So not only do you have those 3 agencies do that, but right after the CDC memo and the Fauci appearance, the 3 societies were the AMA, so American Medical Association, American Pharmacy Association, American Association of Hospital Pharmacists. They came out 2 days later, I think it was September 2nd or 3rd, and they put out a memo that went out to the country and was magnified throughout the media, that the 3 organizations call for an immediate cessation to the prescribing and dispensing of ivermectin. Did you ever see one of those memos or statements about fentanyl or oxycodone? But suddenly they're acting like this is such a public health threat that these 3 societies are calling for the immediate cessation and prescribing of one of the safest medicines in history. And I'm watching this like clown world go on. I'm like, are you kidding me now? I mean, can anyone believe what is happening? And it seemed like I was one of the few who knew that this was completely corrupted and controlled. But anyway, that's an example of that tactic.
I mean, we've seen similar in the UK with the leaked WhatsApp messages that were sent by Matt Hancock and others and the government officials around suppressing information relating to the vaccines. And there was a recent one that came out that I'm going to paraphrase, but it said, what better way to dismiss this than get the regulator to do it?
I saw that. Yes, exactly.
And it just, that's just chilling. I think the last one, the fix, is actually also links to what you were saying about Fauci, but manipulate government officials or processes to inappropriately influence policy. What's your...
Well, Now, that example, and I think the best example of that in regards to ivermectin was the Andrew Hill saga, which my friend, I think the probably the biggest and largest source of ivermectin corruption comes from the UK. Not only the principal trial, the principal trial from Oxford is the most brazenly fraudulent of what I call the big six, because there was really 6 large trials that purportedly showed that ivermectin were using the same tactics, like you said, super low doses, super short durations, enrolling patients super late, making sure they were super healthy, like young, under 50, people weren't going to die anyway. And then they have the outcome as death. Nobody dies, or maybe one person dies and they blame it on ivermectin and just the usual nonsense. But I mean, principle was so brazenly fraudulent. The what was the other trial besides principle? The Together trial had some Brits involved in it, and then the Andy Hill saga from University of Liverpool. I mean, Andy was my friend at one time. We were collegial. We would share data, insights, experiences. He was the lead researcher for the WHO, and when he was done with the contract at WHO, he published a profoundly positive paper on ivermectin. It was 24 trials, randomized controlled trials. It was a meta-analysis, and it showed large statistically significant reductions in death, hospitalization, and duration of illness. And he published that in June of 21. And then what the next things that you saw is basically the short story is there, and they got to him. And I called him out on Twitter one night, a little frustrated, and I did have a drink, and I did use a bad word. But I literally felt, I felt he was committing a crime against humanity, and I said so using a curse word on Twitter. And what's interesting is the next day, I got called into the principal's office meeting. RFK Jr. called me the next day. And I'd already got to meet RFK, and RFK was telling me I'm a hero of his. I'm like, no, you're a hero of mine. But he called me the next day and he just said, Pierre, delete that tweet. You can't be doing that. He said, I'm going to need you to be an expert. Well, because he's a lawyer. He's like, if you're going to serve as an expert, if I'm going to need you to, bring some credibility and your expertise, you can't be tweeting that stuff. And I was like, done, delete it. But Andy Hill got captured. He ended up self-retracting his paper. They created some doubt around one of the trials that he included, saying that trial was fabricated. It may have been, it may not have been. I actually don't think it was at all. I think they needed to single one out so that you could cast doubt on the rest. And
so the need of doubt.
Yeah, they took an Egyptian trial. And by the way, Egypt is known for zombie trials. So it's not that far afield to say that an Egyptian but it was one of the top universities in Egypt. And they said that he completely fabricated it. I knew the principal investigator because I had lectured with him at a biotech conference. And I reached out to him immediately after I heard this stuff. And he just said, that's not my data, what they're showing in public. But then he never responded to us again, and he went quiet. And by the way, I think they got paid off to stay quiet. So they sacrificed his studies being corrupt. And then Andy self-retracted his paper, republished it 2 months later after removing all potentially fraudulent studies. He literally whittled his evidence base down to nothing. And then he tweeted to the world that after revision, ivermectin no longer has an impact on mortality.
Let the tweet decide.
That was when I let the F-bomb fly across Twitter, and not my proudest moment, but I felt like I had to.
Wow. So all of the examples in these 5 steps of kind of the disinformation playbook, we've looked at ivermectin. Now, that was clearly your concentrated focus amongst other things during COVID, but, now several years on, have the blinkers come off? Are you seeing this now play out in other drugs? Is this a generalized war on repurposed drugs or off-patent drugs? Have you now seen evidence beyond ivermectin?
Well, the simplest is a statement I've said now for a couple of years, but I always say, listen, I wrote the book, The War on Ivermectin, but one of my colleagues could have written the book, The War on Hydroxychloroquine. Same war, same tactics, same results. I mean, here's one interesting, I think you're going to find this interesting, Dan. The one major difference in the disinformation campaign against hydroxychloroquine and ivermectin is as follows. When they were manipulating the trials to show that those drugs didn't work, with hydroxychloroquine, they gave a barely sublethal dose of hydroxychloroquine where in hospitalized patients, they gave such high doses. They gave doses that no one has ever heard of before. They were like literally 10 times the treatment dose or some ridiculous magnitude more than you would give for malaria. No one has ever understood why they used such a high dose. It was just under the dose of lethality or toxicity. And sure enough, the patients died. The patients got hydroxychloroquine, did worse. And that's how they tried to destroy hydroxychloroquine by saying, hey, it failed in this trial and the patients did worse. With ivermectin, it is so safe, you could literally give someone 100 times the dose and they'd be fine. In fact, they'd probably get better quicker because there's a dose response. So what did they do with ivermectin? In those manipulated trials, they gave as low a dose as possible for a shorter duration. Whereas with hydroxychloroquine, they gave super high doses for longer because they knew they could make people sick at those doses. Otherwise, same campaign, same tactics. What else have they done? Then they've done, similar tactics, but for the other side. So if you look at vaccines, the fix, fraudulent trials, the blitz, they go after anyone who calls out the vaccines. Hello, I just lost my boards, right? Not only for ivermectin advocacy, but for attacking the vaccine program. Alliances with societies. Are you kidding me? All of the professional sides that got bought off by championing, even the OB-GYNs of the world, right? Literally, obstetricians across the world were advocating to vaccinate pregnant. They violated like the central golden rule of their specialty, which you never give a pregnant woman anything unless you know it's safe for her and her child, right? And yet they all just mass vaccinated with a gene therapy. I mean, it's bizarre, but so I would say, yes, I've seen those campaigns, promoting things and attacking things. The tactics work for both. The alliances, the doubt, casting doubt on vaccine injury, right? Things like that. The one thing that they did, which is interesting, is, what the term a limited hangout is?
No.
The limited hangout is where those that are trying to propagandize and censor you, they realize they cannot do it 100%, otherwise they'll lose credibility. So they let a little piece of truth come out to make it seem like they're all above board, right? And so the greatest example for like a limited hangout is when suddenly you saw that you could discuss the topic of myocarditis and pericarditis with the vaccines. Now, that was immediately responded to with still very rare, 1 in 2,700 boys. But then it was also followed by other propaganda, which is you're more likely to get myocarditis from COVID. BS. We knew that wasn't true. But they couldn't make it sound like the vaccines were 100% safe. So they allowed just the discussion of myocarditis. And as someone who was researching these vaccines, I saw what they were doing because I was screaming about it's not the myocarditis. There are people dropping dead. There's heart attacks. There's strokes. There's Guillain-Barré. There's neurological injuries. There's chronic fatigue syndrome. And there was so many things that were decimating people. But yet the only side effect that anyone could talk about or worried about was myocarditis. And so that was like an example of a limited hangout. So they do all sorts of stuff to mess with what you know and what you believe.
Well, and then more recently, you've been looking at cancer. This is fascinating for a number of angles. What led you to start looking at cancer in particular?
Cancer is exploding.
Have we got cancer wrong?
Yeah. Yes. We haven't cured cancer yet. We're just trying to give people options that are safe, really actually quite inexpensive, well-tolerated, and that improve outcomes. One group got high doses 3 times a week of IV vitamin C. It doubled survival time. Vitamin D, especially high-dose vitamin D, phenomenally improved outcomes of cancer.
Thank you for tuning in to this incredible conversation with Dr. Pierre Kory today. Every time I look back over the last few years, I'm constantly reminded of just how deep the corruption and conflicts of interest run within our medical, scientific, and public health establishments. But I take great comfort that there are people like Dr. Pierre Kory and others who continue to pioneer and fight the cause. And as you heard there at the end now, Dr. Pierre Kory's work is not stopped at ivermectin and other repurposed drugs. He is now looking at how he can take his knowledge and his pioneering approach to the field of cancer, which I think is incredibly exciting, that he is now tackling the true big C with his work. And I encourage you, if you'd like to hear the remaining conversation that I had with Pierre behind the scenes, then please do join our Live Free and Prosper Dan Astin-Gregory podcast supporter community at danastingregory.com/supporter, where you'll hear the conversation in full with Pierre on his work with using repurposed drugs in cancer and more. If you're interested in this subject, you'll be pleased to know that Dr. Pierre Kory has also introduced us to Dr. Paul Marik, who he mentions in the course of this interview, who has really started to pioneer work here. He's a mentor to Dr. Pierre Kory, and we're going to be inviting him on the show to explore alternative therapies to cancer, which I think is such an important subject with the proliferation of cancer that we're witnessing in the world right now. Another medical pioneer who we're delighted to be in contact with. So watch this space. So do head over to danastingregory.com. Make sure you join our mailing list to keep up to date with our latest content. And if you'd like behind-the-scenes access to conversations like this with Dr. Pierre Kory, where we go into depth on his current work, then do become part of our supporter program. And remember to subscribe on all your favorite platforms. My name is Dan Astin-Gregory. It's great to be with you again today, and I look forward to seeing you on the very next episode of our show. Until then, live free and prosper.